Welcome to our video tip on how technicians can start preventive care exams at your veterinary hospital. This is Wendy Myers with Communication Solutions for Veterinarians in Denver, Colorado, and we help practice teams with communication skills, client service, and compliance. At Communication Solutions for Veterinarians, we're one of the largest phone skills training providers in the veterinary profession, having trained nearly 5,000 teams in both the United States and in Canada. So when we look at how technicians can open up your preventive care appointments, the very first thing that the employee needs to do is thoroughly review the medical record for that patient before walking into the exam room and know what services and products are due for today. You'll also want to clearly have a plan so that then you're able to communicate with confidence what services are needed. Now, when the technician goes into the exam room, I love for you to greet the client and the patient by name. And if it's a new client, I usually am a little bit more formal and call them Mr. or Mrs. But if it's a returning client, you've got an ongoing relationship, it's certainly acceptable to be on a first name basis. I do like for you to shake the hand. I think that's a sign of respect and professionalism. And then just review with the client what services and products are due. And that kind of helps sets the expectation for what the plan is for today's medical visit. So let me walk you through a sample conversation that the technician would have with the client. I'm going to talk about the tip that each of these elements brings to the conversation. So the very first is to introduce yourself and explain what your role is. So you might say, well, good morning, I'm Wendy Myers, the technician who'll be assisting Dr. Olson today. Then you want to explain the services that are due. And I want to talk about a couple of the key phrases that I've put here. I want you always to use client-friendly terms, avoiding any medical jargon. So I would explain to the client, for your pet's preventive care visit today, we're going to do a nose to tail exam. I always lead with the exam because that's the first thing the doctor does, and I really want to place emphasis on the professional services. I then say we will do vaccines. I don't mention which specific ones because the doctor's going to do a more thorough history and ask some risk assessment questions, and then that may result in adding or subtracting particular vaccines. I also like to use heartworm tick screen as a way to describe the blood work that we're going to be doing today. I don't want to use abbreviations or jargon that they may not understand, such as 4DX. I just simply call it a heartworm tick screen. Also an intestinal parasite screen, and avoid the medical jargon of the term fecal, and we will refill your flea tick and heartworm preventative. So this is kind of giving them a preview of what services and products will be due today. Then you'll want to explain your role, saying that you're going to take a brief history, collect samples for testing, and get the pet's temperature, pulse, and respiration. Now, this helps the client by communicating brief history to kind of give you a summary of what's been happening with their pet. I don't want them to go into long detail because they're going to really have the more detailed history with the veterinarian. And then lastly, ask, is there anything else that you want to be sure to discuss with the doctor? Because what you're trying to identify is any sick pet or health concerns that the client has. So let's break down a couple of the key points here in the opening script for a technician to begin a preventive care visit. I'd like for you to always use the term preventive care exam instead of wellness exam. You know, I find that the term wellness exam sounds optional to many pet owners. They think, oh, my dog or cat is young, healthy, you know, they're mostly indoors. They really don't need a wellness exam. I think that sounds optional. Where if you use the term preventive care, it's more actionable. You know, I want my pet to stay healthy, so I'll come in for preventive checkups. Also say vaccines, because remember the veterinarian is going to tailor that based upon the patient's risk assessment. And then saying we will refill encourages them to refill their flea tick and heartworm prevention and really follow your standard of care for 12 months of parasite prevention. And then the last question that I asked in that script is there anything else that you want to be sure and discuss with the doctor? What this does is it identifies any sick pet concerns up front. So let me give you an example of what could happen. So the doctor goes through this cat's whole preventive care visit and then closes with, did you have any other questions? And the client says, oh yeah, you know, Fluffy's been going potty outside the litter box for about 3 weeks now. Is there anything we can do to fix that? Well, Inappropriate elimination issues probably just added another 20 or 30 minutes to the exam time. Had the technician front planted that question and the client would have identified the inappropriate elimination early in the visit, the technician probably could have replied, anytime that a cat has inappropriate urination issues, the doctor always wants to do a urinalysis to determine, is that a medical problem or is it a behavior concern? Let me go ahead and take your kitty to the treatment area now. I'll get that urinalysis test started so that we can have a solution for you today, because clients really want a potty problem solved yesterday. So this, by front loading the question, is there anything else you want to be sure and cover, you're going to identify some of those sick pet concerns, and then the doctor may reprioritize the order in which services are delivered today. So I hope you found our tip on how technicians can begin preventive care checkups helpful. You can get additional information on our webinars, our training programs, and my books on our website at csvets.com.